Well, in the clinical trial that she enrolled in, we now have the results, and I had presented these at the American Society of Hematology meeting in December of 2022, and we're on the verge of publishing the results. And in that trial, we found that patients who were randomized, who were MRD negative after induction therapy, who were randomized to receive blinatumomab plus chemotherapy at 3 years had an overall survival of 85% versus 68% for the patients who received just the standard treatment of consolidation chemotherapy. So this was a significant difference in outcome. So this definitely showed that the addition of blinatumomab to chemotherapy benefited these patients and improved survival. So we think that this represents a new standard of care for these patients. There was no increase in adverse events in the patients that got blinatumomab plus chemotherapy. By adding blinatumomab to chemotherapy in this fashion, one is potentially lengthening the amount of therapy that patients would get. They also need to get the blinatumomab by a continuous infusion. So that is, it can be a challenge for some patients and for some hospitals. Now, I will add that there are some studies showing that blinatumomab can be given subcutaneously. It's not yet approved by any of the regulatory agencies for this, for its use subcutaneously yet, but we anticipate that that will happen. And so a subcutaneous injection could be an advantage over this continuous infusion.